Hi, I'm Dr. Steven Struck. I'm a board-certified Stanford-trained plastic surgeon in Atherton, California. I wanted to introduce you to our practice. This is our Atherton office. We also have offices in Los Gatos and Morgan Hill. When one considers a rhinoplasty, there are really two areas of your nose that you should evaluate when you're thinking about it. One is the bump on the nose, which is a classic area. We take the bump down fairly easily. We either use a file or we take the bump down manually. So you think of your bump, that shows mainly on your profile view. Next area that we can address with the rhinoplasty is the tip of your nose. We can make your tip less boxy, a little bit pointier and finer. A lot of people have a wider tip and they want that fine-tuned or narrowed. Some people also have a tip that slightly turns down, if you will, like this. We can elevate the tip. So I think of those as the three areas that I like to address with the rhinoplasty. A dorsal hump that shows up from the side as a bump on your nose, a wide or boxy tip, or a tip that's sunken or plunged. How do we treat each of those? The bump is actually very easy. We make a small incision in the nose, which is very well hidden. It's right down here at the base. I make that incision, I lift the skin up, and I can see everything. You'll probably notice I don't have surgical videos of the actual rhinoplasty. The reason is you can't really see anything on a video. I'm the only one that can see it. I make a very small incision that's hidden. I take the bump down first. Once I've taken your bump down, I usually have to break the bones of the nose and bring them together because the bump sits like this. When I take the top off the bump, your bones are kind of wide apart like this, and I need to push those bones back together again to give you a narrow nose. If you just leave them like this, your bump's going to be gone, but your nose is going to look much wider. So first step, take the bump down, bring the bones in. Second step, I actually look at the tip cartilages. I look at the shapes of those cartilages and I refine those, usually with sutures, bringing them together to make the tip more delicate or pointy. Most people don't like the wide tip. And the third part is occasionally I'll put a graft in to elevate your tip. After we've done those portions of the procedure, I just close your little incision, which is quite small, takes about 5 stitches, and I put a splint on, which you wear for about 5 days. Usually there's a little bit of bruising, usually in this region of the eye, for about 5 days as well. So a splint for 5 days. The next phase, often when you take the splint off with a decent sized bump, you'll see it immediately. You'll see good changes immediately. If it's a smaller bump, the swelling will often offset that. In general, we like people to wait 6 months to see their final results on a rhinoplasty. But for larger humps, you usually see it more immediately than that. So again, rhinoplasty is very rewarding. Surgery is done in an operating room, about 2 hours under general anesthesia. It's done as an outpatient. You wear your splint for 5 days, and we watch the swelling go down for 6 months. We do offer free consultation here at Struck Plastic Surgery. If you found some things interesting during these videos, come in for a consultation. We can individualize your treatment plan to your needs. Spend some time together, find out what your needs are, and create the perfect plan for you. Thank you.